So, let's start with the payers. Initially, when we launched, we didn't really have a value proposition. It's like, we're going to collect this data. We think someday it's going to be important. I can't tell you how. And you can imagine how well that went. So what we have been trying to do is to say, all right, look, how can we integrate into your cost structure? And I think one of the biggest learnings along the way was that we were asking the wrong people to pay for the product. So going to the ASC or going to the hospital and saying, hey, would you like to pay us a premium so that we can go save $10,000 for United Health is not the world's smartest business model. And we're really more like a glucose monitoring company. We're really more like CGM, where we're saying, look, you know, we don't make insulin, but we know that if we monitor your diabetics, they don't touch, they don't go to the ED, they don't do these things. We're saving you a bunch of money. And if we do that, can you split some of the found money with us? So that has been how we've reached out to both hospitals now and to payers, which is to say, look, you're looking after your TKA patients is actually more expensive than creating them, than operating on them. And a lot of that is costs that can be that can be avoided. And so if we're able to reduce your cost by $10,000, $12,000, would you be willing, to provide us compensation, some level of that as compensation for doing that work?